fast as it can go. So those of you who need to do things before Christmas that you planned since last Christmas, you better get started. All those persons who wished, who had all these wishes to do things before the year finished, uh, just lost Dr. Richard there. You need to get busy doing what you have to do because the year is going by and the time is not waiting on you. So get busy. We hope to get back Dr. Richard at some point. Don't know what happened there, but he was having some issues with his communication, and hopefully he'll be back on. But I want to tell you that those of you who are watching, you can tell your friends that they can tune in. They can go to Safe TV Channel 2, or they can just put Dr. Joseph Haynes on YouTube, and you will be on live on our program every Thursday from 6 to 7. Okay? Every Thursday from 6 to 7, you can put Dr. Joseph Haynes in, and you will find our health program to be interesting, because what we do is we teach you a lot of things, and we also share ideas and share conditions that most of you might be suffering with. And we have information that also helps with giving you solutions to your crises. For instance, we were able to put together something that's very, very special for diabetes and also hypertension. Those of you who are chronic, or you've had your hypertension for a very long time, or your diabetes for a very long time, and you're not able to control it, we have formulations now that you can take, and hopefully if you follow the procedures, you will be able to come off of all the drugs that you're on, because those drugs are hurting you, if you want to believe it or not, right? Many of you who are on drugs for hypertension and diabetes will eventually end up with kidney troubles. And then you'll end up in dialysis. And then after that, you know what is happening, right? There's not much hope after that. Okay? So you need to try your best to comply with the dietary restrictions that may be provided to you. And also, you can visit us at the clinic in Kitty. I almost said in Kitty. We were there before. And you can get your, on recommendation, you can get your formulation that's designed for your reduction and hopefully correction of your hypertension or high blood pressure and diabetic states. So don't be afraid to call or visit us. The number's on the screen. And also, if you have an issue on your health on our program, once I'm live, you can call in the 231-6477 number. I will answer, and we will try to give you advice as to what to do regarding your situations. We've been doing that now for several years. As a matter of fact, since 1996. We've been on television with this program since 1996. And most of you who would have looked at us when you were younger, I hear that from some people. Oh, when I was small, my mother and father used to tune in and I used to watch the program. And you can still do it. You know, go to Safe TV Channel 2 if you'd like, or go to Channel 2 on the television. It's on there on Thursdays from 6 to 7. Or on YouTube, you can just type in Dr. Joseph Haynes at 6 o'clock on Thursdays, and you're going to find us live on television. Okay? Live on YouTube. All right? Now, we had very interesting conversation last week, and we're going to have interesting conversations again. Okay? Dr. Richard is trying to get back on there. Okay, Dr.
Richard. Got kicked out.
Well, okay, we're on live, Dr. Richard. Hopefully you'll be able to stay there this time.
Yeah.
And I was doing some introductions regarding our discussion and what we did last week, what I did last week, what we talked about. And I was just stating to the folks who were watching that they can call in and we will try to help them with advice on what they can do to overcome conditions they have. We shared information regarding the formulations that we have for hypertensive and diabetic persons, high blood pressure and diabetes, or people say sugar, right? High blood pressure and sugar. So, you can, don't be afraid to call in or visit us at the clinic in Kitty, or call and make an appointment and come in and we'll do our best to try to help you with whatever condition you have. Dr. Richard, welcome to the program.
Thank you. Thank you for the invite. Thank you for allowing
It's
me.
been a little while since you were on.
Yeah.
And I know there's some people who look forward to seeing you,
Really?
Yeah, man. There's people who look forward to seeing you on the program and some who look forward to seeing you in person whenever you show up.
Well, I'm here.
There's some people who are looking for you in Guyana
Oh yeah,
in person. They want to see you in person. So
yeah. I gotta.
try and make that possible for them. If not this year, early next year, something like that.
Oh wow, you give me some leeway. Early next year.
So in September, I know that it was stated that that you're going to try to be here in September, but
Yeah.
I'm only saying that now because we're in the middle of September almost.
That's right.
And,
Yeah,
you didn't
time
tell us
goes, boy.
yet, so.
Yeah, but I'm coming. I might be there already. You never know.
You never know when you show up.
Yeah, I'm there every day though.
Yes, you're there every day. Persons see you every day, which is good. And I'm glad that you're on to help with some of these questions whenever they come, and to share your experience with the persons who tune into us. But today we want to talk about a few things.
Mm-hmm.
Today we want to talk about parasites again.
Oh boy.
We want to talk about sexually transmitted diseases,
Mm-hmm.
and we want to talk about cancer. We want to be able to speak a little bit about them, but we wouldn't get into details extensively on the three of them at once. But I am noticing more and more that, we talk about hypertension and diabetes, but those are, or I would say, conditions that are normally known or seen. We see that every day, all the time.
Mm-hmm.
Sexually transmitted diseases, we don't see it seldomly, we see it regularly. It is regularly seen, and it doesn't have any age anymore.
No.
We see it in young teenagers, 11, 12 years old, 13 years old.
Mm-hmm.
We see it in persons who are in their 60s and 70s and even 80s.
Yeah.
So there basically is no barrier or no age pretty much anymore.
No limitation
when it comes to that. And I think people take it very lightly. They don't really take it very serious, because if they did, they would do their best to try to get treatment that would help them to overcome it.
Mm-hmm.
Right? Did you know, Dr. Richard, that there are doctors out there who are saying to the women, young and old, that if they're having a discharge, a vaginal discharge, that the vagina is cleaning itself? Would you believe that the doctors who are saying that?
Yeah, I would.
So when the persons come to me with the discharges, which we see many, and they say that to me, I would ask them if it's a male or female doctor that said that.
Mm-hmm.
And if they say female, I would tell them, when you go back to that female doctor, tell her that she needs to see a doctor, because she also has a problem that needs to be fixed. And if it's not fixed, it could create serious problems for her, like it is also for you, who came to see me with that problem, right? And then I would ask them to tell me what happens to the women who don't have a discharge if their vaginas don't clean anymore.
Mm-hmm.
Of course, because they're told that it's cleaning itself. Then
Right.
if the women are not having discharges, then I guess they're not cleaning theirs. Or theirs are not being cleaned. So the logic that they're using is not. It doesn't make sense because not every woman has a discharge.
That's true.
But those who have need to be looked at, to have determination made as to what is causing it, and they need to get it corrected because if they don't, they will end up in some serious crises later. I don't know if you want to add anything to that.
No, it's a truth. I mean, it's reality. It's true. I mean, a lot of times when I see some patients, and you go through, like you do the history, and you ask specifically if there's any discharge, they'll initially say no, but oh no, just the normal.
Yeah, it's just the normal one.
Yeah.
I hear that too.
Yeah. So I know at that point in time, I would inquire about, what is it doing? What's going on? And then when you come to find out, and you go and you do the test, and you follow up, because a lot of times when patients have discharges, they usually have UTIs, and a lot of times those UTIs are unexplained. They would say things like, and I would ask them, so do you have, like, at times UTIs, and you're wondering why is it that you're getting it? Say, yeah. Oh yeah. Why is that? As a matter of fact, some would say right now I have something going on. I'm going to the bathroom often. When you check, you see like an over abundance of candida, lots of it.
Right, I was going to mention that there's a lot of yeast. Yeah.
And I mean, some people think that it's a normal thing, but then candida is classified, when you really look at it carefully, is a sexually transmitted infection, STI, and so it's just education. A lot of times we're not really educated, or misinformation, I should say, and we live with that, and they live with it, and they're having consequences because of it.
Yeah. There's some women who would also say to me that they notice that it's happening when they use other toilets outside of their homes. When they go to the public toilet, or the toilet in this class, or the school toilet, or it's something that they experience from the toilet. Well, what happens in the toilet? The toilet can create problems for women too, and men.
Yeah.
Before they sit on the toilet, sanitize the toilet somehow, and make sure the toilet is flushed properly, because sometimes there's a problem with water. In some instances, some schools don't have water that's coming on a regular basis to fill the tank in the toilet.
Really?
Oh yeah, we have those issues.
Oh boy, that's the problem.
Yeah, so they may have to use a toilet that is not flushed. Yeah, if there's any, believe it or not.
I mean, a toilet that is not flushed, meaning that the person who went before you, the stuff is there?
Yeah.
No.
Yeah, believe it or not.
What?
Believe it or not, yes. Yeah. We have instances where that is the case because
it's unsanitary, man.
Yeah, it is. There's some schools that don't even have water tanks. They may have pipes that would provide water, but when the water cuts off, because they have that, the water stops running, and there's no water to flush.
That's a big problem there. That's a huge
problem. It's a very serious problem. We have teachers who have confessed to me that they hold a urine until they go back home. Yeah. and they're in a classroom for 5-6 hours.
No, it's not good.
Can you see why they may have infections? They have backflow of urine. They have, cystitis and I mean, it's reality. It happens here.
That's bad.
Yeah, cystopylitis, where the backflow of the urine infects the kidney. How
Mhm.
much of that didn't you see? We see it all the time, right? And much of that comes from the fact that they're teachers, number one. No, sometimes they're business owners too, and they may be in the marketplace, and they don't want to use the toilet in the market.
Mm.
Yeah, yeah, because they felt that they were afraid of who was there before or what they may pick up, and so we have issues with that situation, which needs to be corrected.
Yeah, it needs to be. It needs to be.
When we talk about development in Guyana, it's not just about roads and bridges, and it's about those things, those situations that affect people, not only the teachers but the children too.
I mean, when you put it that way, with those events that you just said that are happening, to me, the Latrin is a lot safer.
Exactly, the outhouse, we call it. Outhouse is a lot safer.
Yeah.
Yeah, it's a lot safer because it has a pit, and you're above that pit, and nothing spills, or you don't have to worry about flushing anything down, and
Right.
make sure you wash your hands or something. Who knows? They may go back to some of that. There's some places with that still, believe it or not.
Yeah, that's safer than uh, going to a commode or supposedly high tech compared to that, right? And there's no water. What's the use?
Yeah,
What's the
might as well
use?
go back to the pit toilet, because you
Yeah,
can't
it's
flush the
safe.
one you have, that's a toilet.
It's not unsanitary as the other thing. And the problem, that is bad. And the need, that's why, there's a lot of infections, UTIs and things like that.
Hmm.
And
So there are some situations that legitimately contribute to infections besides sexually transmitted infections. And we find that most of the times it's the person who has a place in the market, a teacher, or someone who works someplace where there's no toilet or no facility where you can release yourself, either fecal matter or urine.
yeah.
So they have to hold it until they go back home.
Hmm.
So we have that situation that occurs, but then we also have the situation with the legitimate sexually transmitted infections,
Hmm.
where persons are having those infections and don't even know they have them.
Mm.
And then when you find them, they would say, "Well, I just had my physical done, and they didn't pick anything up." But wherever they had the physical, didn't explain to them that the parameters that are set, and if your condition doesn't reach the parameters, the level of the parameter, there will be no detection.
That's true. And then the device that we are using, it just detects cells. So you may just have one or two or three or four, whatever amount of cells of that microorganisms there, but it's detected. These things multiply, you know. So a lot of the tests that they run, like you said, they have the titer and they don't meet the titer. So, however, that don't mean that it's negative.
Yeah, it doesn't mean that you don't have a problem.
Don't have a
And the
problem.
other thing that happens in many instances that, which is very common, persons may go to see a physician somewhere, and they would have labs done, and labs may come back, the results come back and says, "Oh, everything is okay. There's no problem. I mean, everything is good." I had that today 2 times. That the person were told that, "Oh, you're okay. There's nothing wrong with you," and I was well. But then the persons continue to have the problem. Now they know that they have an issue.
Yeah,
You
yeah,
know, so they know that if everything is okay, I shouldn't have this issue.
yeah.
You see,
Hmm.
so it's like underdiagnosing or misdiagnosing or whatever you call it, but you have to get better. We have to get better. If you want to have a healthier nation, then we have to put facilities in place that can detect without being biased.
Mm-hmm.
And also, we need to have physicians who will take the time to ensure that they address the concerns of the person or the patient. You know, so when they come to us and we have to spend all this time with them, an hour or more, and we have to screen them from head to toe, and we give them this list of things that are wrong. They look surprised. You know, wow. I mean, all these things wrong with me? Yeah, they're all wrong with you because when you come to us, we don't screen your head if it's your head is a problem, or your hand or your foot. We screen you from head to toe.
Yeah.
Because it's one body you have, one organism,
Mm-hmm.
one human being that has many body parts. And we need to check the entire system before we say, okay, you're good.
Yep. And it takes time. And, don't want to do a rush job. I mean, if they come, we can check them just like in less than 3 minutes.
That's what we used
That's
to do.
it.
It used to happen like that. When you come within 5 minutes, you're gone. That's what used to happen. But what we were treating was pretty much the symptoms that you had. Sometimes
Right.
we would also get lucky and the medicines would hit the causes. But that is what happens now in most facilities, but not here anymore.
It's-
We stopped doing that. We stopped doing that over 14 years ago.
yeah. I mean, the type of people that you're seeing are the patients, I should say, you're seeing are people they've gone everywhere. And the problem still continues.
Mm-hmm.
So, as a last resort, or I should say, in some situations, last resort, but as you're in a situation where there's like hopelessness at times.
Yeah.
People come, they come. Some are recommended, but they come with some interpretations. They're like, well, I don't know, maybe is it going to be? Is it going to help me? Is it not? And when they do get help, they'll let you know.
Mm-hmm. Mm-hmm.
They go on the list of places that they've been. Even abroad.
They only tell you that when they feel better and then they say, you know what, I wish I'd come here before because I know I would have saved all this money and I wouldn't have to go there. I would have to hear all the stories.
Yeah.
Those are common things we hear now.
Yeah, common. It's common.
Yeah.
So, when I have a patient, especially somebody who has referred somebody, I know there's a history.
Yeah.
And initially, they don't come with the history to tell you initially until you figure out exactly what's wrong with them. Or sometimes they come and they don't tell you much of anything. But then when you go through the system, you say, well, aren't you feeling this? Aren't you feeling that? Doesn't your stomach hurt? Yeah. Then they open up and say, wow, this is amazing.
Yeah.
And it is, It
Yeah.
is amazing what we're doing. I mean, it's a blessing to be able to actually see what is happening in the body and to show in patients exactly where the problems are. And when they see it, they can tell. I mean, they know. They say, yep, that's exactly what hurts.
Yeah.
That's exactly where I'm having.
That's exactly where the pain comes from.
Yeah.
Yeah.
Yeah. Yeah.
This is, man, I've been going around for all this time, and if I only knew you guys before, I had a classic case today. Actually, there were two today.
Yeah.
But one was local in Guyana, and one was in Florida. Both cancer cases.
Wow.
Yeah. There's one of the most dangerous cancers is pancreatic,
Mm-hmm.
and the guy, the person, he was referred to us because he took chemotherapy for a condition that he had. The tumor was at the pancreas.
Yeah.
And it was in a place where it was very difficult for them to administer chemotherapy on him.
Mm-hmm.
So they wanted to do surgery to remove the tumor. Of course, they had done this. First, they did an ultrasound and they saw it. Then they did an MRI,
Mm-hmm.
and it was recommended that he gets a biopsy, which he got the biopsy.
Mm-hmm.
Biopsy went off and it came back positive. He had stage 4 cancer.
Wow. Pancreas?
Still has, yeah, stage 4 pancreatic cancer.
Yeah.
And they did administer some chemotherapy already on him,
Mm-hmm.
several doses on him, but nothing happened,
Mm-hmm.
right? And they don't want to do the surgery because of the location of the tumor.
Mm-hmm.
Anyhow, he was referred to us in Florida, and I saw him today, just today. When I screened him, I realized that indeed the cancer is at the pancreas,
Mm-hmm.
and I saw why they were hesitant to do the chemo on him there, because it is at the point where it's right at the liver.
Oh, okay.
See? So when you administer the chemo, it's not just at the pancreas. It wouldn't affect just the pancreas, it'll affect the liver.
Mm-hmm.
Well, guess what? The cancer is not in the liver.
Mm-hmm.
It's at the pancreas. It's in his chest cavity. It's in the lung, left lung. I found it in several places.
Mm-hmm.
Several places. But he didn't know it was all over there.
Mm-hmm.
See, what they said to him is that they saw some nodules in his chest cavity.
Oh, okay. Yeah.
Well, the chest cavity, the cancer is in the chest cavity,
Mm-hmm.
and so what happened? I said to him, I don't want to really tell you what to do, but are you going ahead with the chemo? He says, well, that's why I came here, because I'm afraid that if I do the chemo, because he was also not very, he's weak. The immune system is very weak.
Mm-hmm.
Right? The other thing that was discovered is that the guy was full-blown coronavirus,
Oh, wow.
not just in his lungs, but also in his trachea,
Mm-hmm.
right? So he had coronavirus really bad, and it is affecting him also. But he didn't realize that was what was affecting him also, his breathing and all of that.
Oh, he's having problems breathing, probably difficulty.
Yeah.
Mm-hmm.
And then he didn't know that the cancer was in the other places. You see?
Malignant neoplasia. Yeah.
Yeah.
Okay.
Yeah.
Mm-hmm.
Also, I said to him, now, if you do the chemo, if the chemo is administered at the pancreas, what would you do about the cancer in your lung? What will happen to the cancer in your lung? What will happen to the cancer in the chest cavity? Are they going to do chemo there too? He says, well, I don't know. They didn't talk about that. They just talk about the pancreas. So I said, you see,
Mm-hmm.
now, when this chemo is administered, now you know that it's not just in one place.
Mm-hmm.
What happens to the other areas where the cancer is? You see?
Mm-hmm.
So I had to educate him in many ways today, and I felt sorry for him because he was totally unaware that the cancer was in other places.
Mm-hmm. Wow.
Anyhow, that was a situation where, and the other thing that was very, he was vaccinated,
Oh. Yeah.
coronavirus vaccinated.
Mm-hmm.
You see?
Yep.
You see where that is going?
Yep. Yep.
So we're gonna try to work hard with him, and he's willing to work with us. So try to see how best we can help him to allow his body to try and fight.
Yeah.
So hopefully overcome it, but it's not going to be easy. It's going to be
Yeah.
it's a lot of
There seems to be a lot of cases like that we get now.
getting a lot of cancer cases.
Yeah.
A lot of cancer cases. I had one yesterday. I had another one where Um, she came for another opinion because another stage 4 again, and this is in the colon.
Oh.
Yeah, stage 4 colon
Mm.
and gallbladder.
Mm.
So I don't know. I'm really getting more and more concerned about the frequency of the cancers that we see in persons. The frequency. It is almost running along the same path with the STDs or the STIs.
Yeah.
You know, it's really consuming a lot of people, and they don't have many options. So the other thing that I wanted to go into with that is the dietary changes that are needed to be made to avoid the onslaught of the cells proliferating the system and taking over the body.
Yeah. Very important because I know you probably told him about the protocol. You gotta get off of all flesh, all dairy, and all that stuff. You had a problem with that, right?
Well, you know that the system will recommend it. Right? So we went to his dietary restrictions,
Mm.
and he said for the first time he's being made aware that the foods are also factors that need to be considered with this cancer.
Mm.
You see, so many of these guys out there, or ladies out there, doctors out there, are not educating people nutritionally wise, because you need nutrition, you need an immune system that can work for you.
Yeah. Mm.
If you keep eating foods that work against um, your betterment, then you're not getting anywhere.
No, 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 no. You're actually speeding the thing up. You know, because
Making matters worse.
yeah, you're giving the nutrition that it likes.
And the other thing that I saw, which is what we talk a lot about in another person with cancer this same week, um, the cancer was in an area where parasites outnumber themselves. We found, I actually found in that particular organ, 11 different types of worms.
What?
11
Wow.
parasites.
Yeah, yeah, it happens. Yeah, but
You know,
that's and they were not aware there was anyway. Yeah,
no,
yeah,
no. There's a direct linkage
direct. Hmm.
between the cancer and the parasites, and many persons are not aware. Many doctors are not aware of that.
Yeah, that's true.
Because what happens with these worms, we don't know how long they were there. They eat, mess, and multiply right in your body system, and they nest. They become they. You can mistakenly take a nest of worms for a tumor.
It looks the same, like it's a mass.
It's a mass.
Yeah.
Yeah, it actually looks like a mass,
Hmm.
and it's a mass. It's a mass laden with worms
Hmm.
and fats and fluids and toxins and debris that need to come out of your system.
Yeah.
So it's not, the more I screen, the more it makes me realize the task we have, the job we have, not only in trying to help persons to overcome these conditions that are taking them out, but in educating them and convincing them that this is what you need to do.
Hmm.
It's a really it's a tiresome task because people are not being told these things in other places. So when you tell them that, it's like you're going up a hill that is so steep, and convincing them that you need to change your habits, you need to stop eating these things, your body is talking to you, listen to it.
Yeah. Nobody else told them that,
Yeah.
and they don't want to. A lot of times it's difficult to change.
Change is not easy. change change is changing habits is not easy.
No, no. It's
Especially when your habits that you've had were there for years.
yeah. And then you come to see us, and we tell you, you got to get off of all flesh, all dairy, especially fish, which
Oh,
I do see that you eat. Because why? Why am I jumping on the fish? Because I'm seeing a lot of fish tapeworms here. People don't realize that we can tell when we see the different worms whether or not they've eaten fish or
yeah.
chicken or
Mhm.
beef or whatever,
Or they come from a mosquito.
or mosquitoes.
Mhm. Yeah.
Well, that's an ongoing thing, man. Because we've been talking about that for a while, and we're still talking about it because
It's rooted in the conditions and the
it's
causes.
yeah, and that's one of the big shockers with a lot of people when they come. They don't realize that the food has a very direct relationship to the conditions that their body are experiencing. You know.
I've had um, I've had patients who, and it's happening more and more, who would have odors,
Body odor.
body odor, vaginal odor, when they pass gas, highly offensive odors,
Mm,
and they're saying, is it normal? Is it? I mean, why when I pass gas or when I have this discharge, it smells?
mm.
You know,
No, it's not
it
normal.
is. It is. It is. It is. It makes sense for you to understand that if something smells obnoxious, it's something that's gone bad. Something is rotting in there. Something's spoiled. Something is putrid.
Something is not right.
It can't be right.
Yeah.
And you need to get yourself looked at. You need to get yourself checked. You need to really have an investigation done to see why. Why? I've had persons who would have said to me, and this is just experience and things that affect other people that need to know. When I'm in the bus, because public transportation, when I'm in the bus, everyone just turns at me and looks at me funny, like something is wrong with me, but I don't know
Mm-hmm.
what it is. But I have this odor,
Mm-hmm.
and I don't know where it's coming from. And I've been going to doctors, and they can't tell me where it's coming from. But yet, still, when they sit in the midst of people, the people turn up their nose. You know, so it
Mm-hmm.
means that some toxic situation is occurring in your body system and is coming through your pores, in your sweat, in your perspiration, in your breath, in your, it's coming out of you because it's in there and it's putrid. So what what I recommend people to do, and I do it more and more, is detoxify, cleanse your system at least once per month. Cleanse. It should be regularly if there's a problem. But at least once a month, you cleanse your system, detoxify and deworm. Deworm every week because you're eating dead stuff every day.
Yeah, that's for the people that eat a lot of flesh. Yeah, every week you got to.
Every day you eating the dead stuff. You're
Mm-hmm.
wondering why? Because it's spoiled, it's rottening, it's not digesting properly, it's in your colon, it's in the pockets of your intestine. And all that means that it's coming out in your gas when you pass it, or when you belch, or when you perspire.
Mm-hmm.
I think I don't think people understand the physiology, how the body works. And I would say to many persons, instead of spending the time on your phone, on YouTube and Facebook and all that, look and see how your body work. Google why you're having your problems, even though Google sometimes is wrong.
Yeah.
Facebook or the other one. At
Mm-hmm.
least learn how your body functions. That way, if something happened to you, you may have a little idea as to why it's happening to you.
Yeah. Yeah.
Spend more time learning about yourself.
Yeah, learn about your body and learn about how your body, what's going on, what's good for it and what's not good for it. There are people who know exactly what is going on in their systems, and they know exactly when something is not right because they keep in tune. And it's very important for for us to do that. All of us actually.
Yeah,
'Cause,
yeah. I deworm. It's automatic for me that I take the worm medicine. I consume no flesh, no dead, but I still take the worm medicine.
yeah, because worms are still found in vegetables and fruits and things like that.
Larva. Yeah.
Yeah, and a lot of times,
Mosquito bites too.
yeah, mhm.
Yeah.
There are people who've stopped eating flesh for years, and they're like, "Wait a minute, oh my God, there are all those worms in me. I don't eat no." And these worms, if you have not dewormed, you get off of flesh and you get off of meat, but you never really dewormed.
You never cleanse the system of the worms.
Never cleanse it, and it happens all the time. And that's the common complaint. No, tell me something. Where are all these worms coming from? I haven't had meat in 40 years or 30 years. Well, you ask one simple question. Well, when you got off, did you deworm? No, I think too, because I don't eat it. But you were eating it before.
Mm-hmm.
These things bear eggs and they have generations. They're living with you and they're growing with you as you go on.
Great grandchildren.
Yeah, they're living and dying too.
Yeah.
So no surprise. But it's something that it's there, and then people take it lightly, but it affects their body. I went and got a very old, I think I was mentioning to you, a very old book on nutrition, and it's amazing. I mean, I think we think we have a lot of information, but a lot of times the old books got the stuff.
Yeah. Yeah.
The old books got the stuff, and
They got the formulas.
yeah, they got the stuff, and the information that is deleted or not mentioned. There's a reason why.
Oh, yeah. Yeah.
I know I went to medical school. They never taught us about vitamin P.
Vitamin P?
Vitamin P.
Oh, yeah. Yeah.
Vitamin T and U. Have you ever heard of that? I never. The almost heaven. And everything is important, like vitamin P. They call it flavonoids, bioflavonoids. And that is, usually found, when God made the fruits and everything else for a reason. Those are found under when you peel a citrus fruit, the white part on the bottom of the peel.
Yeah.
That's where it's found. It's found in the skins of fruits. That's why when you were told years ago, when you eat an apple, don't peel it. Eat everything of it.
Mm-hmm.
But then what happens? Now they realize, or somebody realized, that these particular bioflavonoids or vitamin P is very, very, very vital. Very vital to keeping our blood vessels in the right with the right
clarity.
Yeah, with the right size and everything else, and protected from being destroyed. So now they went, instead of you able to eat an apple, they put what they put on the apple. They cover it with a whole lot of wax.
Yeah.
Why did they do that?
They do it because of commercial. They made it commercial, and they have to ship it to long places, far places, and they They have to put the protective devices inside to make them last longer. You
But
know,
then in the process of doing that,
they're killing you.
yeah,
Yeah, that's the reason why you have to cleanse. You have to detoxify yourself because when you eat the apple and you eat the skin, you're eating wax also with it.
yeah, and whatever else
And whatever chemicals were sprayed
was
before the
sprayed
waxing,
before, yeah.
you know?
So there's a sort of, I mean, a sinister sort of reasoning behind all of that,
Commercial, dollars, money.
you know.
It's all about money. It's not about the human race anymore. It's not about helping you to live longer lives and so on. It's about profits and losses and, you know,
Yeah, and you're losing. We're losing. We're in the losing end. And everything that they're doing to acquire the paper, the dollars, is not. Most of it is not beneficial to any person's health.
no, no.
And this bioflavonoid, you can get it, and they recommend, like, for example, there's a real case of a 52-year-old woman coming in with a whole lot of pain in the joints and everything else. Every joint you think of was in pain. They give her 3,000 milligrams of bioflavonoid, vitamin P, and within 3 weeks, the pains were gone. And this is stuff that they've done. This study they've done, and they've done it, since the 70s. This information was known.
70s.
Yeah.
Mhm.
So bioflavonoids, vitamin P is still out there, and people who know about it and know what to do with it, they're getting results. So I mean, I'm saying just to say, there is a lot of things out there that we are not aware of, even though we're dealing with this stuff and many other people. But information is sort of fragmented.
Yeah.
That there are things that can be of help to people, So this thing is there, and it's good to use for people with hemophiliac, people with problems with anemia and all that stuff. They've been benefiting from this.
Let your food be your medicine and your medicine be your food.
Exactly.
There's no fibbing that. It's real.
Yeah.
But the problem with that is the chemicals that are used
on the food.
To grow the foods and to
Mhm.
harvest them, and and that is where the destructive element becomes. That's one of them.
Yeah. You could be eating very healthy things.
Yeah.
But the fertilizer, the things that they use to spray,
Chemicals that are sprayed, the wax that they put on, the preservatives.
Mm-hmm.
The preservative. Another thing that happened just today, actually, is that I questioned someone seriously about conditions that I saw, and one of the things that happened to them came as a result of AG or MSG.
Oh, that's a problem.
Monosodium glutamate.
Mm-hmm.
And she said, well, I don't use any of those cubes, those little cubes. I don't use none of those, and I don't use any AG. And, Ajinomoto is a thing in Guyana, which is used quite a bit. It's chemically formulated.
Yeah.
But I don't use that. So I'm thinking, I said, well, if you don't use MSG or AG or cubes, then why is your body laden with monosodium glutamate? Why? So I asked her another question. He says, what type of seasonings do you use or do you buy? She says, well, I buy the packet seasonings.
Oh, they have MSG.
Which it's just cook-up seasoning, fried rice seasoning.
Yeah, they have MSG.
Says, okay, what I want you to do, look on the package. And if it has anything to do with monosodium glutamate, throw it out. because that is what you're getting. But I use it. I use it to make my cook up rice and make my, my gravy.
Yeah.
Those things are laden with MSG.
Yeah, they are.
And the thing is that it's not. I don't think people are aware that the MSG is disguised in many ways.
Yeah. And what they're doing now is, they're writing these things in very, very, very small
So you don't read it.
letters. Yeah.
Your eyes go over it. You don't see it.
Yeah, the font is very, very tiny.
The trickery in commercial.
Yeah.
It's sickening, man. It's sickening. So you continue to be poisoned and you don't know.
Yeah. They call it soft kill. You're dying every day. The food is killing you. And I got caught with that too. I bought something and I'm looking for the thing, for all the ingredients. And I need a magnifying glass, boy.
Yeah. Yeah, because it's so small you can hardly read it.
Yeah.
Even with 20/20 vision.
Yeah.
You see, so they're trying everything possible to trick you into using the foods that encourages you to want to keep using it, that are killing you, that are contributing to your cancer state and your high blood pressure and your, because it is a deadly formulation that is put together chemically that kills you.
Yeah.
Slow poison. It makes you become addicted to it.
Yeah.
So the food doesn't taste right unless you put it inside.
Yeah.
You see? So we're not only battling, trying to convince people that they need to eat better. When they try to eat better and they use those seasons, it creates another issue.
Yeah. And they're healthy food, but then they're using those things to season them and to get the food tasty. It's good to eat tasty food, but that monosodium glutamate will kill you.
Let me tell you, when I think of the task that we have on a daily basis, trying to help people to overcome their conditions, their pains and discomforts and their illnesses, and it makes you tired, mentally exhausted.
Yeah.
It becomes more and more of a harder challenge.
Yeah.
Well, we have to keep doing it, I guess.
Keep doing it, and the only thing is sometimes we get these hard cases, and people come, and then they disappear. You don't hear from them.
We have 2 minutes more, Dr. Richard.
Yeah, you don't hear from them.
Yeah.
But they're doing what they're doing. They're recommending people.
Yeah.
They're recommending a lot of people. And a lot of times when you do see them, and I do see them, they find out that, everything is good. They're good. They're gone. Things are gone, It'd be nice to find out sometimes. They come back.
Yeah, it'd be nice to see it,
Yeah, because sometimes some cases I'm concerned, and I'm thinking about
yes,
the person.
Yeah.
And,
it'd be nice for a person to come back and say, you know what, I just want to let you know that I'm good. I'm okay. Everything's all right.
It worked and things like that.
We see that a lot with babies.
Yeah, with kids.
One of the easiest things we do here is to help people to conceive.
Yeah.
And many times, most times, the babies are born, and another baby is born, and you don't until you see them one and say, "Oh, I forgot to tell you, now I got 3 children."
Yeah. Because and that's okay. I mean, I'm not doing it for
you don't mind.
any glory or anything like that.
It'll be good. It'll be good to know, so you can encourage someone else, and they do refer. They do tell.
They do tell a lot of people. And,
they do. That's how the persons would come to visit us, because somebody who had an issue got rid of their issue, and then they tell you, "Oh, you want to get rid of your issue? You go and see Dr. Haynes. Go to go to Kitty and find them."
Yeah, I had a couple of cases like that this week. I'm like, oh boy. Well, but the person told me, "You know how I came here?" I said, "Well, how you came here?" and they named the person's name. I can't remember.
Yeah.
They had this problem and at this time, and they got rid of it, and they told me about it, and that's how I came here. I was just told, a person told me this week, I was just told 2 days ago, and I came here, because I have a similar situation. So,
And then you have the other person who is tired of going where they go and they're not getting any help. Dr. Richard is up. Time is up. I just realized it's 7 o'clock.
yeah,
So I mean, we're gonna continue our dialogue, and then people are afraid to call sometimes because they don't want anybody to recognize their voices and all that sort of thing.
yeah, that's all right. I mean,
You have to put the pride away, and if you have a problem, you call, and we'll help to help you to overcome it. You got 2 doctors that can recommend for you, and then there are people who out there who are listening that have the same problems you have that will benefit, right? So you mustn't be afraid to call, right? Anyhow, Dr. Richard, we have to go because the time is up, and I want to thank you for participating. Very good dialogue. We'll continue to do our work. If you want to make an appointment, just call us at 231-6477. And don't forget to tune in and tell your friends every Thursday between 6 and 7. Just type our names in there, Dr. Haynes or Joseph Haynes on YouTube, and you'll be able to join us and enjoy some free lessons that you don't have to pay for, right? And it's a healthy program. All the family can look at it. It's wholesome and it's edifying, so you can benefit. So Dr. Haynes, Richard, I want to thank you for participating. If you have anything quickly you want to say.
Yeah, just you may not feel comfortable calling, but just call and make an appointment. I mean, a lot of people don't like people to know what's going on with them, So
and you call us, and you make your appointment. Come in, and you can have your privacy and your issue solved. And those of you who have high blood pressure and diabetes, we've got the stuff that you can take that can help you to overcome those conditions once you comply with the dietary restrictions. So thank you, Dr. Richard, on behalf of the Health and Wellness Center and those folks who are responsible, like Joy and Esteran and Eleni, for temporary time. Fiona is supposed to come back and join us again. So, we have a good staff here who understands what to do. So don't be afraid to call, make your appointment, come in, and let's help you to get better. Until we meet again, so long. Good night.
Good night.